Knock knock. Hello, my name is Tracy. I'm your nurse today. So provide privacy, hand hygiene, introduce procedure. Today I'm going to do head to toe assessment. Is that okay? So, well, what's your name?
My name is Emma.
What's your date of birth?
My date of birth is April 16, 2013.
Okay. Do you know where you are?
I am at the hospital.
Do you know what is the president of United States?
The president is Biden.
Okay. So, can you get up? So I'm going to measure your weight and height. So I'm going to measuring your weight and height and calculate BMI. If below 18.5 is underweight, is over 30, which is obesity. So can you just walk for me? Okay, please sit down. So patients can maintain posture, patients straight. So can I check your vital sign?
Yes.
So I'm going to check your temperature. Okay, 97.7. So check your O2 set. Okay, 98. So check your heart rate. Heart rate is regular, so I check 30 seconds and times 2. Okay, patient's heart rate is 64 and respiratory rate is 18. Next, I'm going to check your blood pressure. So first, I'm gonna check patient's systolic pressure. Okay, patient's systolic pressure is about 100. Patient's blood pressure is 90/70. Do you have any pain?
No.
Do you feel depression? Okay, so I'm down your I'm down your general survey and document findings. So next, I'm gonna check your skin. So I'm going to check your skin color. So skin color is even, no paler, no cyanosis noted. So I'm gonna check patient skin texture. Skin texture is smooth. So next I'm gonna check patient's temperature, the skin temperature. So it's warm to touch. So I'm going to check patient's skin, any lesions, any moles, erythema, and also checks patient's bilateral lower extremity at bony part, any edema, and hair distribution, which is indicate PVD. Also, I'm gonna check any clubbing nails. If patients have clubbing nails, which is indicated chronic low blood O2 level. So next, I'm gonna check patient's back at bony part, which is coccyx, elbow, hips, and heels. Check any wound. If patients have wound, then document location, size, shape, and any drainage. So next, I'm gonna check patient's skin turgor at supraclavicular. So patients, there's no sign of a dehydration. His skin is tanned, which is indicate patient's dehydration. So next, I'm going to check your head and neck. So I'm gonna check patient's head. The skin color is even, smooth. So hair distribution, there's no lesion. And check patient's eye and ears at same level. Face is symmetry. So next, I'm gonna check patient's trachea is in midline. There is no enlargement of thorax noted. Usually is non-visible. So next, I'm going to check patient's lymphatic nodes. So any tenderness? There's no enlargement noted. So next, I'm gonna check a patient's neck range of motion. So can you look up? Can you look down? Can you turn your head to left and turn your right? So next, I'm going to check patient's cranial nerve 5. Can you close your eyes?
On my forehead, on my cheek.
So cranial nerve 5, which is also check patient's TMJ. Can you open your mouth and close? There is no tenderness or clicking sound noted. So patient's cranial nerve 5 is intact. So next, I'm gonna check your cranial nerve 7. Can you smell? Can you do frown? Can you puff your cheek? Okay, so patient's cranial nerve 7 is intact. So next, I'm gonna check patient's cranial nerve 11. Can you shrug your shoulder? Okay, relax. Can you turn your face to the right? Can you turn your, okay, patient's cranial nerve 11 is intact. So next, I'm gonna check patient's carotid artery, one at a time. Can you turn your head to the left? Use a pen light to check visible pulsation, which is indicate JVD, is from the right side of ventricular, which is indicate right side of heart failure. There is no JVD noted. So next, I'm going to auscultate patient's carotid artery. Use the bell to hear any fluids. If hear swinging or blowing sound, which is indicate hardness of the artery. So, and document findings. So next, I'm going to check your eyes. So patient's eyelids, no dropping, symmetry. So I'm gonna check your conjunctiva. So patient's conjunctiva is pink. There is no drainage, no redness noted. So next, I'm gonna check patient's cranial nerve 2, 3, 4, and 6. So use Snellen chart to check patient's cranial nerve 2. So patient's cranial nerve 2 is intact. So next, I'm going to check cranial nerve 3, 4, 6. So can you follow my pen line? So next, can you follow my pen line? Okay, patient's cranial nerve 2, 3, 4, 6 is intact. Pupil is round, equal, reflect to light, accommodation. Patient's pupils constrict with near gaze and dilate with distance. So next, I'm gonna use ophthalmic scope to check patient's eyes, to shine the light direct to the eye and check patient's pupil reflect to the right light. And also check patient's eyes symmetry. So look at me. So the sparkle is at 12 o'clock, which is patient's eye symmetry. So next, I'm gonna check patient's ear, nose, and throat. So palpate ears, any tenderness?
No.
And use otoscope to check patient's tympanic membrane is supposed shiny gray color, and check any drainage, redness, or foreign body. So next, I'm going to check your nose. The nose supposed in midline, and nose nasal cavity. There's membrane supposed dark, moist. There's no discharge or redness noted. And next, I'm gonna check patient's mouth. Can you just open your mouth? So I'm gonna check oral cavity. Uvula is in midline. The hard and soft palate is, there's no redness or lesion noted. So next, I'm going to check your cranial nerve number 1, olfactory. Can you close your eyes? Tell me what's this?
Opinion.
Okay, patient's cranial nerve number 1 is intact. So next I'm going to check patient's cranial nerve number 8.
Apple. Orange.
So can you stand up? So next I'm going to do the rumbar test. Can you close your eyes? And for seconds, check patients can maintain balance if minor swing is acceptable. Okay, can you go back to your chair? So next I'm gonna check cranial nerve number 9. Can you drink? Okay, patients is able to swallow. So patient's cranial nerve number 9 is intact. So next I'm gonna check your respiratory system. So first check any clubbing nails, cyanosis, and also check patient's respiratory rate. So patient's respiratory rate is 18. Next, I'm going to check patient's anterior chest wall and the transverse chest wall ratio is supposed to be 1 to 2. Do you have any chest injury? Do you have recently surgery?
No.
Okay. So next I'm gonna check patient's spinal contour. Can you stand up? Can you bend forward? Bend forward. Okay. Patient's hip and shoulder is same levels symmetry, and there's no scoliosis and kyphosis noted. Patient's cervical contour is concave. Thorax is slightly convex, and also the lumbar is concave, which is double eyes. So next I'm gonna palpate your chest wall. So any tenderness?
No.
There's no tenderness or mass noted. So I'm gonna percussion your chest wall. The left lung has 3 lobes, and the right left side have 2 lobes. So next I'm gonna auscultate your anterior and posterior chest wall. Have you deep breath? Breathe. Breathe. hear any abnormal sound like crackles, ronchi, or wheezing, and document findings. So next, I'm gonna place my hand. Can you lean forward on your chest wall? Can you just breathing to check chest wall expansion, which is symmetry. So next, I'm going to check your cardiovascular system. Do you have any chest pain?
No.
Do you have any shortness breath?
No.
Do you have any fatigue?
No.
So, do you have do you smoke?
No.
Do you drink alcohol?
No.
Do you have any caffeine intake every day?
No.
Do you exercise?
I jog for 30 minutes on Thursdays.
Okay. What's your dietary patterns?
Rice, protein, and vegetables.
So okay, thank you. And document. Do you have any? Do you use any medications for cardiac function?
No.
Thank you. So check skin colors. There's any paler cyanosis and also capillary refill. So less than seconds. If longer than 3 seconds, which is indicate poor blood flow. So next, I'm gonna check your carotid pulsation, one at a time. And auscultate any bruise. There's no swing or bloating sound noted. So I'm gonna auscultate your heart sound. So the right side second intercostal space is aorta valve, so which I can hear S1, S2 sound. So the left side of the second intercostal space is pulmonary. So the third intercostal space is earth point. The fourth intercostal space is tricuspid. So the fifth intercostal midline of clavicle is PMI, apical and mitral valve. So next, I'm gonna check your abdomen. Can you lay? So check abdomen contour is round, skin color is even. There's no lesion, no scar noted, and an umbilicus is central. And next, I'm going to auscultate the ball sound. For 4 quadrants. So patients have normal boson. If patients normal bosons 5 to 30 per minute. If less than 5 is hypoactive. Is greater than 30 is hyperactive. So next I'm gonna check your next I'm gonna check your kidney. So at the CVA, I'm gonna percussion. Any tenderness?
No.
Any tenderness?
No.
And document findings. So next I'm gonna check your musculoskeletal system. Can you see that? First I'm gonna check your shoulder range of motion. Can you follow me? Okay, can you walk for me? Patients have smooth gain with arms swing opposite with the legs. Can you do tandem walking? Can you do toe walking? And can you do heel walking? So which is check patient's coordination. Patients can maintain balance, smooth gains. So next I am I'm gonna check your head range motion. Can you look up, look down, turn your head left and right, and also your arm, your wrist, your knee, and your ankles. Next, I'm gonna check a patient's muscle strength. So patient's muscle is smooth, form, symmetry. So, can you? I'm going to provide resistance. Can you push back? Okay. Your forearm, your hand. Okay. Great. Squeeze, increase. Okay. Patient's muscle strength 5 out of 5. So I'm gonna check your lower extremities. Can you do dorsal flexion? Can you do plantar flexion? I'm going to check your dorsalis pulse, which is palpable, and so like I'm done your muscle skeletal system assessment. So I still have a 2 cranial nerve assessment. So which is cranial nerve 10, it's vagus nerve, digestion and heart rate, which is also work with cranial nerve number 1. And last is cranial nerve 12. Can you move your tongue? Can you press your tongue to your cheek? Can you say tight like dynamite?
Tied like dynamite.
So I'm done your head to toe assessment, and thank you.